2 at 11.
1 in 8 women, that's how many will be diagnosed with breast cancer during their lifetime. It's expected more than 260,000 cases will be detected this year alone. We recently spoke to a doctor who explains when you should start screenings and how advancements have changed the way chemo is given.
It's good to see you once again. Let's talk about breast cancer and specifically mammographies. What are the basics of knowing when to get a mammography and what you should know going in?
It's been a little controversial lately about when to get a mammogram. Sure. The U.S. Preventative Task Force told us a couple years ago 50 in every 2 years, whereas the American Cancer Society says age 40 to 45 and yearly, and our American College of Radiology as well as the NCCN says 40 and yearly. So the moral of the story is that's really an individualized decision between a woman and her doctor, but I would advocate that that conversation probably needs to happen at 40, and we need to be thinking about mammograms every year.
And certainly if you have it in your family history, mammogram even earlier might be appropriate.
Exactly. If you're known to be a gene carrier or has a very strong family history or other risk factors, that might be even earlier than that. So I don't think it's ever too early to discuss mammograms with your doctor and figure out what time is right for an individual woman.
You've been with Sarah Cannon since 2013.
Correct.
You have seen a lot of advancements in both treatment and detection, correct?
Correct.
Tell me about some of the exciting stuff that's happening.
Yeah, I think one thing, October is next Friday is National Mammogram Day.
Sure.
And our mammograms have actually gotten better. If you think about cell phones, right? Cell phones from a decade ago look very different than cell phones from today. Yeah. And our mammograms do as well. They're not paper films anymore. They're digital. They're on the computer. And our images have gotten a lot better. That's been very helpful in us picking up breast cancers earlier than we otherwise would have. We've also gotten better at tailoring treatments for an individual patient and their risk factor. So not everybody gets the same therapy in a cookie cutter approach. And this has led to improved outcomes for women.
There's still those misconceptions, like if you're pregnant or nursing, probably stay away for the time being.
Right. So it is recommended normally if you're pregnant to not do your screening mammogram. Now, if you find something abnormal, there's other tests we can use like ultrasound. So still raise that with your doctor, but we normally hold off on screening mammograms while someone is actively pregnant.
And someone who's had implants, go right ahead and get your mammogram.
Go right ahead and get your mammogram. You definitely should.
I guess the only thing that you cannot help as far as advance is getting people in to get those mammograms. Everything else you have under your control and you're working diligently on, but it's just getting people there. What are some of the roadblocks that keep people away?
Yeah, I think one of them is just fear, right? People don't really like going to the doctor's office. People don't really like going to the dentist sometimes. I think, the ostrich approach or sticking your head in the sand about things, it's really better to stay on top of these. If we find a cancer when it's small and early, the treatment really isn't that bad. It's so much better than finding it when it's advanced. Mammograms aren't scary. The mammogram technicians are great. They're really not that painful. We really should be encouraging all women to get their mammograms.
And the sooner you catch it, obviously, the better your odds are of surviving and prospering.
Exactly.
Yeah. All right. And I guess the question we kind of left the last time we spoke was this conference that you went to where they talked about this Taylor X. Is that the correct term?
It is.
Explain what that, because a lot of people are hearing about that.
Right. So this was our American Society of Clinical Oncology, our big national cancer conference. Yeah. And a very large trial, Taylor X, reported. And it uses this test called Oncotype that's looking at the DNA in individual cancer cells. And before we knew women that had a high-risk Oncotype for hormonally driven, no negative breast cancers needed chemotherapy, and those that had a low Oncotype did not. But we really didn't know what to do with these women that were in the intermediate or middle category. And this test came out that's now shown us in the Taylor X trial that the majority of these women in the intermediate range don't need chemotherapy. So this translates to about 60,000 women a year that we probably were considering for chemotherapy before that no longer need it. There's some caveats about young women or those that are premenopausal, but it really is going to save a lot of people chemotherapy.
All right. Get out and get those mammograms, right?
Exactly.
All right. Dr. Hamilton, thank you so much for your time. Appreciate it.
Thanks for having me. Yeah.